Hi everyone, I'm Humayra.
My name is Dean. My name is Aiden.
Alright, so today we'll be doing a very cool experiment for you guys. This is making blood models in bottles. So we'll be making two different blood models in these bottles. So one would be normal blood and the other would be sickle cell blood.
To do this experiment, you'll need 2 empty water bottles, 16 ounces of corn syrup, rainbow nerds, but pick out the purple ones, red jelly beans, white beans, cranberries, adhesive spray, a piece of paper, and a pair of gloves.
Cell blood. So sickle cell blood is found in patients with sickle cell disease. So Dean, Aiden, do you know what sickle cell disease is?
No.
No? What do you think? It's a disease of the blood. That's right. So red blood cells usually look like a round disc, right? So today we'll be using these jelly beans to represent red blood cells. So when they're round like this, and they can easily flow through the blood vessels, right? In a sickle cell disease, the blood cells appear sickle. They are no longer round disc, right? They're no longer can flow through the blood vessel properly. So they're shaped like sickle, crescent moon shape. And they carry less oxygen, hardly any oxygen. They do have some normal red blood cells that look like this. So when the blood cells can't carry oxygen to your body, what happens?
You die. The body parts die.
Yeah, there's tissue damage, right? There's tissue damage. For instance, blood carries oxygen to your fingertips or your toe tips or different organs, parts of your body. That's right. But what it also does, because they're sickle cell like this, they stick. When blood flows through blood vessel, they tend to stick to the blood cells. They also stick to other cells, like white blood cells, like we'll be using these beans today for white blood cells, and platelets, this nerd purple candies. And the liquid part of the blood is called plasma, and we'll be using corn syrup today to represent plasma in the blood. All right. So we'll be also using adhesive spray. This is pretty good one to use because what we'll be doing is, because in the sickle red blood cell, the blood cells stick to other cells. So we'll be using the glue to make like little clumps that forms in the blood vessels. Let's make the normal blood, okay? So we said like what percentage?
45.
45. So between most of this, like 40% is red cells, and then we pick like just a few of the white beans or the white cells, and we'll be using maybe like half of these platelets in this bottle. All right. So let's add in and then do you guys want to put like these? Oh, this is gonna look so colorful, right? Yeah. And then, yeah, and I'll put the platelets in. Okay. So you have to put more red cells in because it's not quite 45% yet. 45 is almost 50%, so 50% is up to here, right? Actually, yeah. All right, so leave that in, right? All right, so let me, hopefully I'm careful. There you go. No
Bubbles.
All right. Okay, I think that's enough. Mix it up. Yeah.
Goes down.
It's pretty cool, right? All right. So are you ready to make the sickle cell model?
Yep.
Yeah.
So let's just make the clumps first, okay? That's why we have the adhesive spray and the piece of paper and gloves. So let me try this that way, because they can be sticky. They can be very sticky and stick on your hands. So make sure you use a pair of gloves, or make sure a grown-up is doing this part, right? All right, so let's move the red cells, the normal ones. We'll just put like in each clump, we'll just put 1 or 2.
But wouldn't those come with the normal ones?
Hmm?
Wouldn't they come with the normal ones? Wouldn't they?
So what happens, the sickle cell, because when they express some sticky things on their surface, so they go and stick. Like in a sickle cell disease patient, their blood cells are stickier than normal. So that's what makes the clump, right? They come together, okay?
How come it comes with the white blood cells then?
Yeah, it does, because white blood cells are expressing those sticky things on them too. All right, okay. And then we're gonna put some platelets here. Let's zoom in on that. So I'm just gonna, so stay away. I'm just gonna. All right, guys, we're back. So this is what we have after making the clumps. We can start putting those in our bottles, okay? So I will put the clumps in and you can put the rest in afterwards, okay? Let's finish putting the clumps in. This is really sticky, see? So this is what happens, can you imagine? Fortunately, for this disease, there are some really good drugs that came out late last year. So that's good for people who are suffering from this disease, because what happens again is when you have something like this forming in your blood vessel, it causes a lot of pain, right? Because your blood can't properly flow through your blood vessels, and that causes a lot of damage to the body parts also. Else, I think we can start putting
You're supposed to be afraid of something.
Yeah, so we're gonna add the non-clumps also. There's some.
And this.
The regular. Yeah. Okay, I think that's enough.
Yeah,
That's
that looks
enough.
like 40%.
Yeah, this is good enough. All right. All right. Okay. So you can gently shake it. See what happens? They're all clumpy.
It doesn't move fast.
It isn't. It's also not moving fast, right?
Yeah, the other one
Sticking to the side of the bottle. Look at that. All right. There you have it, guys. 2 different blood models, sickle cell and
normal blood cell.
there you go. I hope you had fun. Say bye-bye.
Bye.
Bye.